meeting, since we're waiting on one more for a quorum, but it is 2:34, so I will bring the February 12th Health Equity Committee meeting to order. I'm going to do a roll call for attendance. So Melissa Myers.
Here.
Right, and Kate Mildy.
Here.
And Laura Dietrich.
Here.
And Patrick McCormick.
Here.
And Kathy Special.
Here.
Joe Zuzel, interim chair, present. And Sheila Hayes.
Present.
And Jeannie, would you like to introduce yourself to everyone?
Hi, everyone. I'm Jeannie Carraz. I'm your recording secretary for today's meeting. Some of you know me. I worked for NPU for 27, almost 27 years, I think. So before I retired.
Yeah.
So then Jackie dragged me back to do some work. So here I am.
Gigantic thank you for being here, especially since, we're trying to kind of figure out things as we go. We're a special committee where, we are kind of operating outside of the city for the city. So it really helps for somebody who knows their way around all the particulars to be present here.
I did the utility board meetings for years.
Love it.
The whole Robert's rule thing is like, still have nightmares.
We don't have to be that far.
Yeah.
We have to meet all of the requirements before submitting the minutes, the agenda, all of that stuff.
All right, so we'll keep taking down the agenda here. As I mentioned, we can't approve minutes because we can't vote in this meeting without a quorum. If somebody joins us a little later on, we will. But do look at those minutes from January. As far as updates are concerned and chair updates, that will basically get into our subcommittee report outs. Everyone can see, basically what those subcommittee sort of formations look like. And I'm open to discussion about that today. I think that will be the majority of our conversation today. We can also talk about the report that Dr. Qureshi had found and sent out from the city. Philadelphia, was it?
Yep.
Yes, City of Philadelphia, which was a very robust report. But I hope you understand why I included it. It sort of gives us sort of an outline of what we're aspiring for. We did have a guest speaker today, Zakaya Williams from Norwich Public Schools. However, she did have something come up where she needed to attend to one of her children. So she will try to make that meeting at another time. Any questions about chair updates or anything? I'll open it up for folks.
Yeah, I'm afraid I did not get the minutes, and I've just gone through all the emails and I don't see one with minutes. So I apologize if I missed that.
From January, you're talking?
Yeah.
Yeah, so we did have some difficulty with some of our minutes. So some of them were abridged, and I think they went maybe directly to the city, and in our error didn't go to members. So I can recap if that's helpful, if that's what you're looking for. So basically, with our conversation with Representative Darrell Wilson, we had him come as a guest speaker, and he'll come from time to time to sort of sit on this committee, since this was a lot of his brainchild in terms of what the resolutions look like and what we're moving forward. And he was able to provide a lot of clarification for us where I think we originally as a group thought that it was our task, sort of our invitation charge. Thank you. That's it. To complete every single one of the resolutions as they appeared here in the words. And what we found was that they are merely guidance, and that we are actually the subject matters about even the content of the resolutions and which resolutions move forward. And sort of the underlying goal of even having those resolutions was for us to sort of be best practice or subject matter experts in the area of diversity, equity, inclusion, belonging within what we do in our organizations, how we do community outreach, things that we're serving. So the idea is that we create a plan or suggestions or a sort of reflection on the work that we're currently doing, so that we can sort of incorporate that into, give it to the city and see how the city wants to sort of work with that plan. And I think that takes a lot of the questioning. I know, Missy, you and I talked a lot about this. We're doing such great work, and Dr. Walia chimed in about this too. We know we're boots on the ground every day, right? This is the work that we're constantly doing. So for us to think about how we were going to combine or change or redo that work or add to that work was sort of like a really large pill to swallow and try to even understand. So in this case, what we're really doing is reflecting on what we do so that the city can have an understanding of what that works and how that might be applicable. Oh, and Dr. Kresge's joining us. Perfect. How that might be applicable to what they're trying to do too. And really, Darrell had mentioned that a lot of this came out of the fact that, after George Floyd and after we start to see vaccine equity, and, we've all talked about this in various meetings that we sat with, those health disparities and sort of the system of how we were working with diversity, equity, inclusion, belonging work needed to be overhauled and changed. And it's really about looking in the mirror first and then sort of seeing, okay, so based on this, how do we feel like we can work? And there are some tendrils, I think, that also connect to this work and what we're trying to do. For example, when we talk about future funding, if the city has suggestions about funding for DEIB work, we could be a powerful voice in that. When we talk about, the monies from cannabis and how, that filters in and what that works for, we can also help to be sort of the advocates for that kind of change as well. And please correct me if anybody has anything else that they picked up from those meetings that I might have just glossed over, or any questions, any way that I can further clarify.
I think to round it out, go to why the subcommittee
Oh, yeah.
changed.
Yeah,
Okay,
exactly.
That was a big thing. Melissa, the big change is the subcommittees, and Joe was authorized to redo the subcommittees based on our conversation. And
So that's why we have new areas of focus on this agenda?
Correct,
yes,
correct.
that's
Got
the
it.
big takeaway from that.
Correct.
Got it.
Yeah, because one of the subcommittees was the health equity plan. So if that is our major output, that is not necessarily a good way to have a committee, right? So like we're all going to be putting the plan together. We need to kind of splinter this out into ideas. So I did put suggestions out for folks to say, what are things that are sort of large buckets or information that we need to sort of craft the outline of the plan. I did get a couple of suggestions, and then I kind of borrowed a lot from that Philadelphia City plan. You can see even there's similar words, just kind of thinking about that in terms of, our everyday workflow. But if we'll spend a lot of time talking about this today. If you think like I missed a big bucket, or there's a certain theme that doesn't fit under one of these buckets, or we have to talk about other ideas, I'm open to that sort of situation.
Hi, Joe, it's Kate. Hi, everybody. That's an interesting segue. I have been tasked with bringing to the group a couple of possible changes. So if you look at the resolution for this group, numbers 9, 10, and 11 really aren't in alignment with the other things on this. It's my understanding they got added kind of late to the game, and they distract from the work you guys have been tasked with doing. So it's the city manager and human resources position that numbers 9, 10, and 11 be removed from our resolution, our charge, if you will. Specifically, if nothing else, numbers 9 and 10, human resources and health equity, are separate and should be treated separately. And it's the position certainly of the city manager that committees like this wouldn't necessarily influence city operations and how departments function. So I just wanted to bring that to the group. I've been asked to bring that to the group. And the city manager would of course be open to other feedback regarding that, but it's pretty firm position that, again, I can read them out for you. Number 9 is the city manager and human resource director commit to conduct all human resources, vendor selection, and grant management activities with a racial equity lens, including reviewing all internal policies and practices such as examinations, hiring, promotion, leadership, appointments, and funding. So that is not appropriate for us. In addition to the workforce development practices. It doesn't relate to health equity and the type of other work you guys are charged with doing here. So we propose collectively, Bridget Marks, John Salamone, and Kate Mildy to have those taken out of the resolution.
Okay.
Well, it's not this body.
I was gonna say,
It's not this body
yeah,
that-
so we can't change a resolution. That would be the city council that would change that
Yeah.
resolution. And resolution as it stands, I'm sure that others have, input about that as well, since, a lot of what we do around health equity and even how we outreach to the community has a lot to deal with pipeline programs, with what we're training our staff, how our staff interact and actually engage with the community and our population. And I think that all has elements to that. So I definitely hear that, and we'll record that in the minutes, but I think if there is a move to change the resolution, that needs to go before city council to change that. And
Yeah,
we're going to
I
try to
think-
do our best to incorporate all of the points into the equity plan. And once again, that plan that can go, that's for the city, right? That's our charge, is to put that together. So if the city decides that the suggestions that we make around how, we work with human resources and how we work with professional development and making sure that we have equitable training for all of our staff and how to engage with other individuals, if they think that is not a pertinent part of the plan, by all means, they can do how they want for that. So I wish I had an easier, quicker solution for you, but thank you for raising that, Dr.
No,
Koresh.
I hear you. Any way
Oh,
that
sorry,
we
Kate.
can, formalize it, I think we need to continue the conversation. I can tell you that city participation, city support for the structure is waning. And to be able to focus on specific things, not in relation to effectively the city manager's domain and operations. We need to be mindful of that moving forward. And I think that's, certainly why human resources and city management hasn't been represented largely in this group, because it's specific to health equity, and giving any directives to the city in any capacity is not the nature of this group. So if we need to, have a motion to make that amendment and bring it to council, have it on agenda setting, I encourage us to continue that conversation and develop something.
Yeah, so I would say that we just sort of changed how we were going to focus on this committee like last meeting. And I don't think that there was a lot of participation from the city manager's office from the very beginning. So I don't know if it's the change of this that has kind of prompted that change. I'm always open to entertaining motions if individuals do, but we are sort of at the limits of what this committee can kind of move forward. I see Dr. Qureshi has his hand up.
So Joe, I wanted to kind of looking at the 9th, that was just read out. I think my understanding is that this committee is looking at health equity for the city of Norwich, right? So I think if we modify that, the city manager and human resource directors commit to all human resources, vendor selection, grant management activities pertaining to health of the citizens of Norwich with a racial. So in other words, adding the word health, which it's still a broad scope, but it's still, if you're recruiting somebody who's going to provide labs, I don't know, what the city will do with providing health services in some way, or vendors who will come in, but we add the word pertaining to health of citizens of Norwich. That's within our mandate, and that would be the modification I would suggest.
Okay. That's a good suggestion. Other suggestions, comments about this?
Yeah, I have a question. So Kate, you had said that the concerns were raised by the city manager and other folks, which makes a lot of sense. Do they not have the capacity to have something brought to the council that they need us to bring something? Is that,
I'm
I'm
not,
just naive about your processes, I apologize.
honestly, me too. I think if there was some way for him to do it without you guys, he would have made
Okay.
that change.
Okay,
So I think there has to be some sort of official record, some sort of recommendation. Sheila would know more than I do on that.
Right. Kate, that's not true. The city manager can bring forth resolutions or amendments. He goes to agenda setting. He could also ask it to be considered an agenda setting to be brought forth. So this committee doesn't prepare anything for agenda setting. We're opposed with reporting every 6 months.
We have a
Right.
hard enough time getting on agenda setting as it is.
Right, we haven't even gotten any of the other stuff on
We
the
haven't
agenda
got any of
setting
the other stuff on there.
that we sent to the city manager, but it's within his purview. He can talk to he can put forth something himself, or when he goes to agenda setting, he could ask that it be put on by the council. So that's within his purview.
So is that the message you guys collectively would like me to bring back to him, is that well, he's tasked me with getting some sort of endorsement from you guys to make these modifications. You guys are saying, if you want to change it, and it's on you.
well, I was gonna add a second part of my question, actually. Joe, you used the phrasing that we are acting as subject experts, so to speak, as a consultant almost to the city. So these items, couldn't it say that we act as a subject expert, as a consultant, that the city can consult with us if they have questions regarding how health equity impacts the process, the policies and practices of exams, hiring, promotions, et cetera. We all know that if employment wise, if you're going to implement employment practices that involve the health of employees, such as what vaccines are required or whatever you're going to require, you've got to think with a health equity lens. And so it may not sound like they're connected, and for the most part, they probably don't connect every day, all day, but there's certainly items, and if they don't have the expertise in-house, I'm not sure why not. I would think employment law is in there somewhere, but they might want to consult with our group. Maybe that's a way to make the connection that makes sense for everybody. If not, then I guess we decide whether it's appropriate or not. But I see that as the only way. I hear what he's saying, that this is the purview of the city manager and the HR director about workforce practices and whatnot. Is there a health equity lens? There is, and some of that stuff, but I don't think it's our role to tell them what to do with that, as far as it sounds like we're supposed to be advising.
Right.
Or available consultation.
Right. And I agree with you. I mean, I think, the way that 9 is written, this committee didn't write any of these resolutions. They didn't write any.
Right.
So, I can see the city manager, human resource director commit to conduct all human resources vendor selection, grant management. I mean, there's a lot of other things that are part of that. We are the ones who are just providing information on how we did it, right? So whether they want to take those suggestions or not, whether they think that's their purview or not, like, we've done all of those things. Almost every organization on here, I would imagine, we've done all of those things within number 9. So it's basically us just kind of putting together a collection of our work. And once again, Kate, it's their decision what they want to do with it. We have no authority. We can't make the human resource people do anything. We can't make the city manager do anything. We can't even get IT to do anything. So
That's funny. No, I hear you for sure. I think, at the end of last meeting, HR was actually tasked with some stuff from this group. So I'd counter that, if they're going to be tasked with some things from this group, then that changes the nature of it. So I think that is really where the shift happened when we regrouped, and when other city operations were getting mixed up in health equity when maybe, and I see your point, Melissa, that there's certain areas where there's crossover, but largely I think there isn't. And when someone, you know, left with homework that wasn't even really in line with the resolution, it was hard hit the brakes. Let's check this really quickly. So
Well, I mean, as far as homework is concerned, we kind of task that to everyone. So like go back to where you are and look at like what some of your practices are, what are things that you would want for the bucket. So I mean, everybody sort of had that sort of idea. And there were some people who replied and sent me an email, and a lot of people didn't. So I mean, that's another thing about being a committee member. If we're saying that we don't want people's feedback who are on the committee, or certain people will give feedback on the committee, but others won't. I mean, I guess I'm trying to figure out, you know, where the city is on that. So, I mean, anyone who's a city employee, are we not going to ask for their feedback on the plan? Are we just going to give it to them?
yeah, fair questions. And maybe this evolves into, you know, there's not city employee representation as it existed when it was written on here. I don't know. I'll have to bring it back to John.
Yeah.
Well,
I think-
do you feel there's a universal understanding that our charge is to write a health equity plan for the city? That involves all the areas of operation that the city has.
I can't like fully agree because we've been going around for over a year trying to determine exactly what our scope is.
So
And it feels a
that's
lot
where I
like
was
a moving
going.
target. Yeah.
That's where I was
So,
going. If there isn't universal understanding that that's what we're supposed to be doing, and to write a health equity plan, we need this and we need this and we need this, and it's going to come together and look like this, then we're going to run into conflict and tension about our asks.
definitely. So
Exactly.
maybe what we're coming to is revisiting and rewriting the resolution for clarity.
Well, no,
I don't
let's
know.
put it-
I don't know.
I would say, I don't know if it's that there's not an understanding. I'm just gonna be honest. I just don't think there's a willingness on behalf of the city to address the health equity. So let's
Gotcha.
be honest.
And I think, you know, like,
Because, no, I'm just saying it, because to say that she was charged with a task, she had been asked to join a committee when we were doing the other committees. It, same ask, it wasn't any different. It's just, it's not, it's the, this current administration has not embraced health equity, the racism as a public health crisis, and looking at things through a health equity lens. So that is what the clear conversation is about, and the clear pushback is about, which is how when this was declared with COVID, and we still talk about, and you guys still talk about the disparities in health and how it's affecting every aspect of everyone's life. And when you go to underserved and underrepresented and race and culturally diverse people, the impact is higher. And if this city chooses to ignore it, it will continue to ignore it. I'm still going to advocate that we should still have a document where, and if the city chooses, if the administration chooses to ignore the document that is produced, that will be on them. But the work is still important. The problem doesn't go away. And I don't know why they don't understand it.
and you know, I think as interim chair, really what I'm interested in is us being able to make the most of this meeting. So, you know, this is all volunteer for all of us, like everyone who's on here. And it does take a lot of time. And we spent that first year because of process like this. So we couldn't get the right individuals, and then no one wanted to be chair, and we couldn't appoint interim chairs, and then we had problems with recording secretaries and funding and quorums and red line changes. So we had just been able to actually get the idea of what a task would be, what an operational task would be from all of our organizations, and start a plan. And now we're saying that we need to go back to the resolution, which once again, that could stall a lot of work too. So it feels sometimes that as much as we're trying to get work done and actually achieve a product and be productive, that oftentimes we spend time in process or in other sorts of, I guess, like logistics in order to try to get things done. So, I mean, I'm open to suggestions about that. As chair, I'm just trying to see if we can be productive and produce something from this meeting, and not just show up to sort of go back to more processes. So open to ideas about that too.
So Joe, this is Mohammed. Can I say something?
Yeah.
No, so I was gonna say, so this document that we have put together, right? This is the resolution that we are discussing that's here with the items which are bullet number 9, 10, 11. That was created by the council of the city, correct?
Correct.
So that's not something that kind of outlines what we're supposed to do.
Correct.
So we can't change that. That's the council has to change. I know what you're saying now. So
just as much as the individuals who were appointed were not our appointments, right? So those went through, those got voted on the city council. Even when we tried to change them to individuals and put in representatives instead, we've still sort of come up on roadblocks against that as well. So even the individuals who are serving on the committee, we don't have a lot of control on changing that either.
So now going, Kate, just from your perspective, you're representing the city, but you're asking us to change the resolution that the city had made? It's not in
So,
the
yeah.
purview of this committee, right? Is it?
So basically, this now, after listening to all of you guys, all I can come up with is that this resolution has been hard for us to pick apart from the beginning. It's been kind of all over the place, quite frankly. We've tried to figure out exactly what it's asking of us. And I think to Joe's point about getting stuck on process, that's because we don't have a clear guide. So I would propose that we get some rewriting happening, however that happens. And the city manager did come to me and ask me to bring to you guys the fact that 9, 10, and 11 really don't fit with specific health equity, in alignment with the other issues. And I don't think that, his position is that it doesn't matter. It's just that I think he's as equally frustrated with the hangups on process and the constant shifts that we need a better guide. And we're going to continue to go back and forth about it unless, we can bring this to council and say, we need clarity on these things. Here's what we've come up with. Give us a better roadmap to what exactly you're after here.
So just Kate, I'm just to understand this better. I thought the city manager was the one who started this committee. I thought he was the first chair in the beginning, and he didn't bring this up before. So, and then when we look at examples and when we search on different cities across the United States, there were some very good suggestions. I think what Joe just mentioned about Philadelphia one. I think does the Philadelphia document kind of isn't that what we want to do? I thought.
Yeah, that was kind of like
I'm struggling with this a little bit because you also said, Kate, that you were being tasked to rechannel and redirect us, but I feel like we don't want to be wasting our time if this is not what the city needs.
I think that's very fair point. I think, and to your point about John Salamone being the chair, that was an interim chair just because no one was stepping up. And he initially hosted the first couple of meetings because we couldn't get a chair. But then we set these meetings to when agenda setting's actually happening, so he can't come to them now anyway. But again, it's been a long road of trying to figure out exactly what we're doing. And after the last meeting, it became very apparent that it was becoming more operations infiltration, if you will, than maybe overall assessment and suggestions type of thing. And none of us can explicitly say, because none of us completely developed this document. I mean, Darrell was heavily involved and he helped answer some questions, but we're still, struggling. And, I am ultimately the messenger of the city's position. I think HR, I think Bridget reached out to Joe, but I don't know if she did, to express her reservations too. But we think that an overall suggestion highlighting the work that's best practices, embracing health equity absolutely is supported. But the city, like I said, there's limited crossover when it comes to equity across the board and racism as a crisis. We can touch on those things. When you put health in there, that's not necessarily our wheelhouse. So I think that's where some of the hesitation comes from. Getting a collective report of expertise from you guys, sure, but evaluating what we do, again, infiltrating our operations, that's where a lot of the hesitation came from out of the last meeting. So I don't know. I think honestly, the best solution is for me to go back to John and see if there's a way that this can be rewritten that's amenable and more clear.
Yeah, and I think Kate, that I'm saddened that folks from the city thought that we were trying to infiltrate what was going on in the city, because in none of my conversations is that what I suggested. It's more like Missy, I'll use you as an example. If I say, what do you do for health equity professional development in generations? Give me a list of some trainings, who's your consultant, so on and so forth. Like, that's basically what we're all going to be tasked with, is just explaining whatever that is. But if the city is uncomfortable in divulging that information, I think maybe an easier amendment was to what we talked about in the very beginning, is not having city employees on the committee. I'm not sure how that sits within the charter, though, because once again, to Jackie's point, we are sort of a committee unlike other committees within the city. But in no way are we trying to infiltrate or what have you. I mean, we were called by the city to serve the city. So it saddens me that that's sort of how our efforts are being taken, because once again, we are all volunteering in this situation. We are not, we're not, we have other axes to grind. I'll speak for the collective on that, but we have other things that are really our focus right now. And I think the most manageable amount of our time and our expertise is in developing a plan that the city could do with as they think. If we were to actually try to engage individually with each one of these points, those services would be duplicative. A lot of it would be repetitive. It would not be a good use of our resources or our time for those kinds of things. So that's why I think the city plan, as Representative Wilson had talked about, and that is merely a suggestion. That is merely us just kind of putting together as a collective of what we do around health equity.
Yeah, because Joe, if you look at the Philadelphia city plan, which is terrific, comprehensive for sure, it is completely integrated with city practices. So there would be absolutely no way that we could produce something like this for them
without knowing what is actually
with a health equity lens, without engaging all of them in every department and every process and whatnot. Now, your abridged version of here are recommendations on health equity just in general. This is what health institutions in different settings, could be school, school nurse office, the school health, it could be Department of Health, it could be community health center, hospital, et cetera. Here are kind of an abridged version of how we look at health equity. What are the factors? What do we consider? What are initiatives we embark on in the community and within our own workforce, et cetera. I think is the safer bet, because I don't see how we get even close to a city plan unless we are well integrated with city folks and practices. And if that's not welcome, at least an abridged version of what we all do in our realms would give input, would give perspective.
I
And
think that's
I
an
love
easy
it.
pivot. I think that's an easy pivot.
Yes. And so I think to your point, Melissa, we should probably formalize that pivot somehow, right? And maybe it is removing city staff from the committee and, having the resolution be more clear with tasking you all with giving us guidance and sharing your expertise. It looks like Patrick's hand is up.
Yeah, I just, from my perspective, I think there's a few different difficulties you run into. I mean, one is the city staff, so not having a clear vision for what their role is difficult. The problem is they've been on this committee from the beginning, so I think the assumption from all of us was we had that support. I think the fact that the consultant was hired through a city agency or a city department gave us the impression that there was going to be some funding support and that any need for RFPs that would be put out would be done by the city on our behalf. So we can't obviously do any of that work. My hope was eventually there would be more funds available for a contractor to pull a lot of this information together, because it's difficult to gather. And I think a third party going to departments and asking for information as part of a study is more palatable than having Patrick McCormick go up to Human Resources and ask for copies of all their information. And likewise, the consultant could come to my department and say, we're looking for data. We're hoping to put an application together. The city manager's office has applied for funds. The community development office has applied for funds in the past, and they'll ask for data that will support their application. And I could see it being done in that way. But I think the goal of the committee is to make sure the city of Norwich is at least meeting our mission. And I think we can only do that with communication with the city department. So that could be one person who serves that role. I would think the city manager would be that person because they speak to those departments, and they obviously speak to the council on a regular basis. But that would be, if we have to go in a different direction, I would hope the city would start thinking about, how do we collect data using a third party? Who's going to be that liaison between this committee and the city departments? If we have requests, we could put it through the city manager's office, but our hope is that they would turn that around and give us a reasonable response in time for our next meeting so we could take action and, just operate like a regular committee would for the city and provide our minutes and agendas. And as we ask for support, maybe we invite them to a meeting, but we'll do it through the city manager's office. I just think maybe they're looking for something more structured. And if they provide that structure, then we can accommodate that.
That's a good point. Other conversations?
Well, I can give my perspective as someone who just joined this committee.
Sure.
So I know you guys have been working on this for quite some time, but when I read that resolution, it just seemed to me it was guidance, specifically saying the city because this is a city plan. But where 10 and 11 are, that's addressing kind of where I am as Otis Library. It's Bridget might be following exactly what this resolution is telling her to do. The next person who comes in, it's that structure is there as just make sure we're following through with the Health Equity Committee. So it kind of just seemed like a guideline of let's make sure we're looking at how we're testing. Let's make sure is the language available? Let's make sure we're doing all of these things. That's how I interpreted it.
Yeah.
So just kind of maybe as someone coming new to the table, That's how I read it. Not holding the city's feet to the fire, which kind of maybe that's how it looks like, but it's the city because it's the city's plan, but also for 10 and 11, that's the rest of us too. And that's what we want to encourage in the community, is that we are all looking at our operations and how we're actually doing this, and not doing it the same way we've been doing it for a million years. We're paying attention to trying to draw in people of color and what do they need.
I'm glad that you brought that up, because one of the things that Darrell was talking about was that communication about this work has been very poor getting out to the communities. And that's not just from the city. You know, we struggle all the time about, hey, we're doing these great initiatives, we're really trying to do these programs. How do we get that information out? I know FQHCs, Patrick, you guys, we all have that challenge. So I thought that these were more about an opportunity for the city to showcase the work that it's doing in the DEIB space and really show the folks in the community, hey, look, this is what we do. And that's a lot of what my conversation with Bridget was. It's about like some of the practices they were already doing, you know, because it's important for us to showcase that. And I think, once again, if the city's not involved in the plan, that's fine, but they lose that opportunity to really like say, hey, you know, we're working on this. This is what we've done for years. You know, Kate, I think specifically about your department. I mean, you do wonderful things in terms of community outreach, in terms of really like making sure that you have that culturally relevant focus. So to leave that out of the plan is a major gap, since it's human services. But I'm fine with the abridged version too. I mean, whatever's gonna help us to create a product. Any other
I would think the city is going to, this is Patrick, I would think the city would have its own policies and procedures around this issue anyway. And that would just be something that would be shared with us as a committee that we could highlight when we're talking about the work that the city is doing. I mean, the city agencies and departments are just one part of the city as a whole. So I would hope that, you know, if there are hiring practices, there's workforce development, there's policies and procedures that make sure that, you know, that we look to with everything with the health equity lens. I think we're just trying to include that in the information that we gather for the city as a whole. So, you know, we're looking for gaps and ways that we can provide support as a committee, but you know, I don't think we're asking anything that probably the city wouldn't expect of itself already anyway, and trying to standardize some of those policies and procedures to make sure they apply to agencies or agencies that go beyond the departments of the city.
I agree. Anyone else?
I mean, I've said all along, I think my department could benefit from this committee's work if it's, you know, around training, around review of our policies, around, you know, common hiring practices, so we could draw on some of HR's work in the city. You know, I mean, some of those things. And again, applying for funds that would support the city by being able to utilize this committee, I think would also be helpful. So I'm just trying to, there's value added for us to be a part of this group, as long as the work can move forward.
I even think in how we engage, right? So when we talk about, you know, one of the things we're working on is race, ethnicity, and language data, and how we approach individuals to explain why we need to collect it and why it's important. A process and a training like that could be used at the Otis Library. It could be used at an FQHC. It could be used at Norwich Public Schools. If we're all working on the same message and being cohesive in terms of those things, in terms of these practices, then individuals start to develop more of that trust. So I even think of like, you know, with the plan, you know, we say like, we'll give it to the city, but ultimately I see all of us benefiting from that plan as well, because this is the kind of stuff we do in our collaborative work, right? This is the kind of stuff that we do, you know, in our nonprofit meetings all the time. So this would just to formalize it a little bit more, to say like, oh, wow, Generations has this really great way of reaching out. Like, let's all try their way. And like, that's what we do with our community health workers right now, right? We have over 62 of them that we're all training together and working with at the same time through our collaborative. So their information is collective, and, you know, depending on training needs or opportunities, where they're outreaching to, it's a great way for us to collaborate and synergize. So we're not duplicating work, People are trained up, we're organized, we're ready for that statewide funding, that federal funding, like we're good to go. So I do think that
You
there.
know, oh, I'm
Go ahead.
sorry.
No, go ahead.
No, I was just gonna say, yeah, I almost feel like I'm totally, you can tell me if I'm wrong, Kate or Sheila, whoever was there at the very beginning when this first was crafted, because I pulled it up, the original that I got when this committee first started, and there's language in there about us actually mitigating the detrimental effects of racism in the city. And so, and I mean, there's other sentences here about working with the city to actually implement recommendations and findings and mitigate impact and blah, blah, blah. So that's a very direct involvement. And I wonder, was there no discussion at any point with the city council or others about just hiring a consultant for the city who would then help them look at their policies and practices and get them wherever they thought they needed to go? Is that just what, or is that expensive? And so having a committee of partners, it avoids the costs of that, or just thought the committee was more effectual because of, you know, being partners and existing in the community. Because it just feels like we were what most organizations, if you just think like leadership wise, organization or business leadership wise, you go get a consultant. If you have skill sets you don't have and you can't hire it, you either hire it or you go get a contract and you bring somebody in and they help you look at your policies and you adapt, you know, et cetera. So, I was just wondering, was that ever discussed? Because it feels like that's how our committee was written, to give guidance and help impact change. And but if we're not actually working with them on their day-to-day stuff, how do you do that from afar? I guess is the question. So was a consultant ever discussed? Or does no one know?
So there was that initial consultant that was hired just prior to us all starting to gather, and it was a small amount of money, was my understanding, and Leanne had, I believe, hired the consultant.
Oh, the one that did this data gathering?
Right,
They
so
didn't do any data
But that
gathering. no.
consultant wasn't tasked necessarily with what you guys are tasked with. So I
Right,
see your
right.
question, Melissa, and I
Yeah.
wasn't here, of course, that Leanne was director then. But you're right, either consultant or free group, right? So I think the free group was the choice, but
Mm.
then when it became a lot, that's when Leanne decided to maybe have somebody help aggregate the data and, you know, as a consultant. And then we tabled that because we weren't sure even what we were supposed to be doing. So
but I just think I got confused personally because I mean, as we were presenting or bringing people forward, like Kevin Brown, and talking about the fact that there was going to be funding coming shortly through the, you know, marijuana dispensary tax or whatever, you know, I mean, the discussion was around, hey, there's going to be money for this group coming down the pike. So I kind of assumed in my own head that may be used for a consultant to do any of those various types of work. And we would just be sort of overseeing the needs or the ask of that consultant. So I think that was where I started feeling like, hey, we're moving in the right direction. It sounds like there's going to be funds behind this. We're going to have somebody to take the minutes at the meeting. It's less of a stress on the volunteers that are participating in the group. We're going to guide the work that's done, but the work will be done by somebody else. Yeah, that had been my hope all along, was that work would be taken on by somebody other than the folks in this group. Because we really don't have the ability to stretch ourselves that thin, but a consultant could do that work for us.
Right. Well, and then be allowed to integrate with all the city departments and look at policies and practices and advise on how to evolve them and, you know, and whatnot, in a maybe less, not less invasive, but a more comfortable way, I guess. Because it's their person they hired and is just working with them behind the scenes on things and assessing and coming to conclusions. I mean, we could certainly, like you said, Pat, we could give context after about, okay, looks like you want to improve your hiring practices, you know, sounds like your recommendations are to do A, B, C. We suggest you add D, you know, here's a component you hadn't thought of, or, you know, whatever. But yeah, I feel like either you're in or you're not.
And you know, I'll say also, if you know the city is looking for information about points 9, 10, and 11, you know, our community health needs assessment, one of the major needs, the top 10 needs, was recruiting and training professionals who have DEIB knowledge and
Yeah.
are you know, ethnically diverse. Like that came through as a community through our data haven, our statewide. And
Mhm.
you know, Patrick knows that, and you have the information too, Missy. So I
Yeah.
mean, like that, I think that definitely does feed into the work that we're trying to do. Like we have community health improvement goals actually created around that pipeline issue that we're currently working on. So that's
And I
just
would hope-
more
I would hope
information
the
that we
city-
do.
And I would hope the city departments realize we're not looking to fill every need with city department staff. I mean, what we're
No.
looking for is to see, does the city have the capacity? And maybe that capacity could be filled with another, maybe Hartford Healthcare has somebody in that fills that role. We've talked about that before, UCFS, who could come over and do training for city department staff. The city department doesn't have to have that person, or the city doesn't have to have that person on staff themselves. But knowing that that exists in the community and you can tap into it, that's what the overall health equity plan for the city would include. You know, so it's inclusive of all of us, and not just the city departments, not putting the onus on them to have to supply us with a person in charge, but you need to know where the gaps are before you can fill them.
Do we have another report due soon?
April.
April?
Yes.
So that would be a really good time to just kind of submit something,
Yeah.
right?
At least high level. I mean, so with, you know, about 5 minutes left, I want to make sure we're careful of time. I didn't get to really dive into all the elements of the new subcommittees, but my ask, and it's really up to you how much you want to go in, you know, it's not homework, so to speak, or what have you. So like, you know, just take a look at some of these like high level sort of buckets and think about some of the things that you'd be willing to share or information that you have that would be helpful for this. Because you know, the report doesn't have to be super painstaking. It could be just us knowing our business, asking some individuals that we work with, sort of like, what are some of these processes? What are some of these plans? And just sort of compiling it. That would be like most of the work, but the information gathering is not so hard. So yeah, take a look at some of these things. If some of the topics seem like they sort of miss the mark, or they have to go a little bit deeper, or we want some clarifying, I'm open to those as well. If you send myself or Jeannie some of your suggestions, we'll make sure that that gets into our agenda so we can discuss them. And you know, I'm really just interested in us sort of combining our powers to create something that's going to be helpful. And you know, if it's helpful to the city, great. I really do think it will be helpful to all of us. And I'm definitely open to all of your feedback as well. So I don't know if anyone has any super pressing questions about that before I ask for a motion to adjourn.
Just real quick, I'm thinking
Sure.
to have Kate be able to report back that we at least considered her comments and tried to address them. I don't know if you want to take Bridget, maybe Kate and Chief Daly out of the impactful learning and professional development, and then potentially move me or move Dr. Walia or the two of us or something. We had talked about possibly having the DEI person for the UCFS, or I don't know if Missy has somebody that she would recommend at Generations, but I'm just trying to think of something, you know, a way where we can kind of spread it out amongst the group here without having city departments. So at least Kate can say, you know, they took the pressure off of city staff from having to work on these areas. And then maybe we look at things like, you know, a legislative advocacy item that we can address in the upcoming 6 months, or, you know, do we establish a health equity learning what do you call it? A learning area where we could all, the city, go into it and be able to access resources around health equity in the city and direct services. You know, the data collection, maybe we have to just focus on your community health assessment right now to provide us the initial data we need, but try to at least have something in each area with someone from the committee on it, so that way we can move the work forward and not have the city feel like they're being asked to provide time or resources?
Yeah, I mean, I think as committee members, we're all providing our time and our resources. So I think that that's important. In a spirit of inclusion, I don't want to exclude anyone from the city if they're interested in serving. But I think, Kate, when you go back to our city manager and ask if, members from the city don't want to necessarily be included on the committee, that's when we can make those changes. And you can definitely say, that's an opportunity. I would definitely talk about, our pivot in terms of, maybe it's more of like a higher level sort of plan in terms of where our plan's coming from. I think it's important to clarify also like where we were coming from as a committee, because I think it's echoed in all the members sort of what our idea was, and it wasn't any sort of malice or forcing the city to do certain things. I think it's also important to explore the opportunity of showcasing the great work that the city's already doing. And then when I talk about the subcommittees, don't just look at your own, look at all of them and see, where that goes. And obviously we'll take into account if people want to change their committee assignment or change where those go. Good points though, Patrick.
But let me, if you don't mind, can I follow up though with Patrick? Because it sounds like based on what Kate was tasked to do, and Kate, I'm not shooting the messenger.
Yeah. We're not trying to do that at all, Kate.
But I might suggest, since there is this raising of the issue, and John at the same time didn't want his name put on an item, is that we do take the city people off of the subcommittees.
Committees, okay.
Not off of, because we can't take them off of the.
Right, correct.
So take them off of the subcommittee.
Okay.
We feel comfortable with the work that we're doing.
Okay.
And they'll have to choose and decide if there's another committee they want to be on or not. Okay.
So I'm going to entertain a motion for that then. So I will entertain a motion to remove all city employees from subcommittee assignments.
Do we have a quorum?
I'll
Do we have a-
second.
Oh, let's see.
We
One.
Dr.
Yeah, do we-
Qureshi stepped
we
up.
can't
Dr.
do that.
Cressy dropped. I can't.
Okay.
We
So
can't.
So we'll discuss that about making it official next meeting. But that's just kind of an opportunity. I'm sorry, I didn't see Dr. Qureshi.
Can I ask,
I was gonna say, do we really need a motion, Joe? Because we didn't put a motion to put them on there.
We did say that I was going to assign, but it's
I
okay.
know, but what I'm saying is, what I'm saying is if we take them, or if our recommendation is to take them on,
Mhm.
and then let them tell you what committees. I'm not saying for them not to serve on a committee.
Okay.
I'm just saying, let them tell you what committee
Okay.
they want to serve on, okay?
All
Because
or can I offer an alternative? And Kate, tell me if this is totally out of realm. What if we asked if they would review our final document for potential impact on the city, for just some review and feedback about, as a representative of city practices, departments, et cetera, and offer some feedback on our final document?
I'm fine with that. Yes. And
I mean, you guys are
actually-
insiders, so you could tell us, oh, wow, this right here, this is off the mark. Like this, you might want to go another way with this. Or, like it would just be good to have some feedback in the end about how would this be taken?
Yep, I'm happy to facilitate that. And I do actually have to leave, but thank you guys all for being so kind to me as I was the messenger today. And, I really appreciate your expertise. We'll continue to move the needle. And thank you all so much.
So Joe, for our final document, if we're writing up something that summarizes our perspectives on these different areas, are we going to also make the recommendation that see attached example of a city plan and, consider pursuing your own similar?
I think that would be important. I think,
Yeah.
whatever we create, it's our names on it. And so that's really the way that I'm kind of looking at this. It's not up to us to force the city council or the city to do anything, but if we're going to create something, we're going to create something that is inclusive and you know, truthful and all encompassing and useful. I mean, those are the things that I'm really, that's my goal anyway. I think that's the goal of everyone else as well. So I
I
think that
gotta
was
say that it does make it complicated when, you know, like I am the health department for the city of Norwich, so I consider myself as much a city department as anybody.
right.
The library feels the same way, the schools feel the same way, the utility feels the same way. I mean, we don't have an office in the building, but we represent the city. So for the city to say we want to pull our staff out of these meetings, I mean, there wouldn't be a meeting if you pulled anybody who had a relationship with the city out of the meeting. So I just think they have to, you know, somebody has to understand that, you know, I'm here, yes, as a volunteer, but I'm also here because I feel like I had the ask of those people in charge of the city who I answer to, asking me to help to make this thing move forward and be successful with it and, you know, make it something of value to the city. And you know, I think there was a lot of weight added to it by having the council create it and want our support and input and adding department folks to it. And I think if you lose that, it really does weaken the work we do. So and it shouldn't be a political thing. It shouldn't be when the council changes, all of a sudden, there's a different perspective on the value of this group. It should be done regardless of who's the city manager or who's the city council. It shouldn't be able to move forward without any problem. So I'm just expressing it's
I agree.
very
Yeah.
difficult. And I would do the same for any town that asked me to participate that we serve.
All right, so very robust conversation today, folks. We are over time. I apologize. So I'm going to just adjourn us since I don't have to do an emotion.